Americans spend more than $2 trillion on healthcare each year. 20 billion of that is thanks to medical mistakes, according to a new study out tonight. It's estimated medical errors cost the U.S. economy almost $20 billion. And with 1.5 million mistakes, that works out to a cost of about $13,000 each. Jim Toole is the managing director of MBA Actuaries, an insurance consulting firm. He joins us from our Washington, D.C. bureau. Jim, welcome to Nightly Business Report.
It's a pleasure. Thank you, Tom.
So what's considered a medical error in this $20 billion cost estimate?
Well, a medical error is a preventable injury caused by a medical procedure that's not caused by the progress of the disease itself.
Okay, and so with that $20 billion or $19.5 billion figure, who pays for it? Who writes those checks?
Well, unfortunately, Tom, that's you and me. It comes through in our insurance premiums. It comes through in our Medicare costs. So it affects all of us.
It's a cost clearly that's passed around. And as your study finds, much of these cost mistakes are directly related to health care, about 87%, but clearly not all of them. You've got 7% with indirect costs and 6% have just lost productivity of the folks recovering from those medical errors. So as you look at that big top line number, almost $20 billion, what are the options for the payers, the insurance companies, and ultimately you and I, Jim, the patients?
Well, insurance companies have not been focusing on this in the past, and that's why the costs are passed through to the consumers. But I think going forward, they're going to be taking the cue from the federal government, which has made certain types of errors what they term never events. And for a never event, such as operating on the wrong site, the government will no longer be paying for those expenses through Medicare. Insurance companies could do the same thing.
What about the transparency of these costs, of getting your rundown of what was done to you if you're in a hospital and figuring out what you want to pay and what quite frankly, you shouldn't pay because it was a mistake, but yet you're being charged for it?
That's an interesting question. But again, that is up, if you are insured, your insurance company will be picking up and paying for those costs. But it's up to the insurance company to decide if they want to take a stand on certain types of errors and no longer pay for them.
You mentioned the federal government may be setting the tone here when it comes to how it pays for Medicare, mistakes that are made with Medicare. So how does the health reform law that is beginning to go into place address some of these mistakes?
Well, I wish they were taking a stronger stance on this issue. The Institute of Medicine report in 2000 convened several committees and groups, and they said that one of the most important things that could be done is to create a Center for Patient Safety at a national level, so, sort of like the National Transportation Board does to make sure that our highways are safe. Unfortunately, that's not part of the reform bill, and I certainly hope that that'll be taken into account in the future.
Jim, well, certainly the headline number here, $19.5 billion in medical errors, is a big number. We appreciate you sharing it with us and the insights. Jim Toole along with us. He's managing director of MBA Actuaries. That's an insurance consulting firm.
Thank you.